When you first hear about laser therapy, it's a little kind of out there. You think, well, how can light really make that much of a difference? I went into it really skeptically. It wasn't something that was covered in our coursework and, getting my doctorate in physical therapy.
Occasionally when the patients first hear about the laser, they're a little hesitant, but after receiving a treatment, I only hear good things. It feels warm to them, they're more comfortable. Usually they have more range of motion and less pain afterwards.
It was amazing, but we went into it with a skeptical mind and came out really impressed.
And I can tell you, 90% of the people I use the light force laser on have positive results. Even our difficult cases like RA, I've seen results that have amazed me. With my RA patients especially, and we see a lot of them.
The laser's been able to make an immediate response in their pain reduction.
I've used the laser on only a few pelvic pain patients, but I've seen significant results. Usually when those patients come to me, they've had the pain for a long time, it's become chronic, and they've had other treatments done that have not helped or have only helped a little bit, and this really helps push them over that plateau. The pain score for the pelvic pain varies. It can get as high as 8 or 9 and can be reduced even after the first laser to maybe about a 4 or 5.
This particular patient, I had seen her before, significant RA, exacerbation of RA. At the time she came in, her hands were so swollen, she could not even barely move her hands. After the one treatment, that day she was able to make a fist. She called me by the end of the day and just was amazed. I was equally amazed because I hadn't seen a result that way with such acute inflammatory issues like that. I think that was the most profound effect that I had, and the instantaneous tears coming down someone's face because they can go to the bathroom and button their pants.
The biggest story that comes to mind that I think of with a patient that I really didn't think there was a lot of hope for, some severe arthritis, and I watched the gentleman, he only had about 45 degrees of abduction in his shoulder. After the laser therapy, we thought, what more can we do for this gentleman? He's elderly, he's not a candidate for surgery. How can we get this gentleman relief when his shoulder was so arthritic, you could hear it grinding as he lifted. And we said, let's try the laser. We've tried everything else, and immediately his shoulder was to 90 degrees and he felt less discomfort, so it was wonderful to see him get direct impact out of it.
The laser is different with other modalities to compare it to those like the ultrasound or things like that. It gets deeper into the soft tissue and patients usually notice a change quicker.
The versatility of the light force laser and who you can use it on, there is no limitation. We use it on adults, athletes, 95-year-old with skin integrity. So really, you can use it on almost anybody for such a wide variety of injuries. Acute injuries, ankle sprains, love it.
Easy to do, it takes 10 minutes at most, so it's not something that takes a lot of time out of your day to do, and it's impressive to the patient.
There's no cleanup afterwards, it's not invasive, it's not painful, setup takes no time. I think it's even quicker than like stim. When we're really busy and a technician has to go take a patient off of electrical stimulation and take the hot pack off, that is way more disruptive than performing a 5-minute laser. And the laser benefits the patient more. So you can feel confident when you're servicing your patient. It's been the best, most efficient thing that I think we've added cash base to the physical therapy program in the full 14 years.
It's an easy conversation to have with patients with the laser because I'm so confident in how well it works that once they try it, they love it. They usually buy a package for it to continue to use it.
I feel like I'm very successful with my hands, but I can tell you after doing this 21 years, I was thrilled to have this 2 years ago because it offset some of the load on me and did some things that I really couldn't do. So it took pressure off of me, having to do as much deep tissue work. It made my life easier.
Laser is an excellent treatment that helps decrease pain, increases your range of motion, gets you back to your functional activities faster than anything else that I've used.